favorite area to massage?
My favorite area to massage? It probably depends on the client, right?
Oh
I don't know.
yeah.
I mean,
My favorite's the glutes though.
yeah. Yeah, I can see that. Makes sense to me.
Yeah, it's just like one big muscle that you can put your elbow into.
Yeah.
And then they usually twitch and like there's usually like reactions going on. Moved around the table.
Yeah. Good. Yeah. I really like that stretch too.
That's so awesome.
I know, yeah. Yeah, you should try this.
Handle with my bigger male client.
I mean, I've got it like the leg is kind of resting against my. I mean, you have to maneuver it a little bit, and I mean, I really find it really valuable to do this kind of thing back and forth, and that could be challenged depending on the client.
Yeah. I don't know if I would do that part.
Yeah.
For me personally, I don't feel like it's doing a lot for me.
Really? Okay.
But
I think with certain clients of mine, I feel like it gets their hips moving in a way that their hips don't normally move.
yeah.
So maybe you're just flexible enough to where that just
Yeah.
Yeah.
I am more flexible than most clients.
yeah.
So some things I don't feel just because
I'm pretty sure that doing this whole thing, like making these circles and like flexing it up and like all that stuff, I'm pretty sure that I was like improvising and developing with the powerlifter guy. God, he's so difficult to work on.
Yeah.
But he's like swole. He looks like He-Man or something.
yeah.
I mean, like,
Does he do steroids, you think?
nah, I don't think so. He doesn't look that like
Yeah.
he doesn't look that crazy or
But
anything.
do powerlifters just focus on picking up like the bar and
Yeah,
putting it
basically.
down?
He
Yeah.
showed me a video. He came back. He sent me a text message after he won his event. He was like, "I got first place."
Wow.
And then like it's just this little short clip of him picking up the barbell and holding it for like 3 seconds and dropping it. And then he's like, "Fuck yeah." So, but it was like 500 pounds or something. Like, you know, it was ridiculous.
Yeah, of
weight.
course. Yeah.
But yeah, it made me feel good. I was like, oh, I kind of helped that happen. you know?
Yeah.
I mean, he may have been able to do it without me.
No.
But if he was, then he would have been more sore afterwards, you know.
Yeah.
He would have been hurting the next day.
Yeah, but he like maintains himself with you.
Yeah, yeah.
So.
Oh, yeah, I mean, there's no doubt in my mind that I've been helpful to him.
And made it possible is what I'm saying.
Yeah.
But for whatever that's worth, I don't know. It's like so funny what people's hobbies are.
I know. And part of me is like, dude, stop powerlifting. You're strong enough, you know, like you could lift a fucking car if you want, but like you're gonna wreck your lower back over the years, man. But I mean, I don't know. I mean, he's probably fine.
Yeah. But yeah, my client just he does like serious weightlifting, but not like exclusively
Mm-hmm.
that. Like he does anyway. But yeah, he's very muscular and not very flexible.
Yeah.
Tall and heavy. But he's an awesome client.
That's good.
Really awesome. He invited me to like play around with his girlfriend's car. 'Cause she has a,
Oh, really?
yeah, she has a 1975 MG.
Oh, damn.
Yeah.
Oh, wow. It's like a convertible, like a sports car, right?
Mm-hmm. And it's green. Oh, that feels really good.
Okay, good. I feel like there's a little bit more restriction in this hip. I don't know if that's your experience at all. Oh gosh, I have to be careful. I know it's so tender in there.
Yeah, this side so far, I don't know if you're just being more careful, but I'm not. Yeah, you can go a lot deeper.
Okay.
Yeah, I think your thumb. Can I just no, can I do it there?
Okay.
I'm just trying to like aim it, like maybe like yeah, maybe more like that.
And then like move the joint around. Ooh, I felt it.
Yeah. Yeah, I'm really surprised that it's harder to find a sensitive spot on this side.
Yeah?
Yeah, there we go.
That's
Yeah,
a little
that's
bit
more.
sensitive.
Yeah.
Yeah, I'm using more of the tip of my thumb than the pad.
Okay. Yeah. Oh, there it is. Yeah. Ooh.
Yeah, psoas is tricky. That's funny. I was like, "Do you have any eucalyptus oil?" And you're like, "Yeah, it's right behind me." That's great. You got pretty much like a whole collection of pretty much any.
All the bases. I mean, all the basics, and then a few more. Eucalyptus is one of the basics.
Yeah. I got some tea tree, lavender, rosemary, marjoram, ylang ylang, patchouli.
I don't think that. I don't have
Yeah, it's
marjoram.
like I've had it for a long time and I don't know what to use it for, but it's kind of flowery. It's kind of nice. I think it's supposed to be good for memory and like thinking clearly and stuff. I'm having a hard time like finding what to work on in this psoas. Yeah, I think basil is supposedly really good for headaches and clove oil. I've got some clove.
Okay. Yeah, I don't like clove.
Me neither, but I actually got it for my tooth.
Oh yeah. Did it work?
No, I mean, well, I don't quite remember putting it on my tooth, but I remember that it was better to just get a clove, like a whole clove,
Yeah.
and bite on it and like gradually suck on it. I had a really bad, what was it? Some bad tooth. Oh, it was when my tooth was falling apart.
Oh.
One of my wisdom teeth just like broke one day. Yeah, it was scary. It didn't hurt as bad as you might think that it did, or would.
The way you talk about it makes it sound like it didn't hurt at all.
It didn't. It was weird because like half of the crown of my tooth just came off, and there was just like a big gaping hole in my molar, like in one of my wisdom teeth. I just tried to keep it clean for the few days until it took me to go to the dentist, and then they arranged a wisdom tooth surgery, and I got them taken out like when I was 36 years old or something. And I was like, I was told when I was a teenager that these were fine.
Yeah.
And they didn't have to come out, but they eventually did.
I guess they were wrong.
Yeah, but it wasn't a big deal. Having my wisdom teeth out was no problem at all. I didn't take any of the oxys that they prescribed me. It wasn't painful enough for that.
Yeah.
I actually did take like an oxycodone or whatever kind of medicine they gave me, but it just made me feel like crap.
Mm-hmm.
So I was like, ibuprofen is good enough for this.
I'm so sorry my table moves so much.
Oh, that's okay. It's kind of surprising.
It's really surprising. Like, it doesn't move so much when I'm working on people, right? And that makes me wonder, like, what is it that we do differently?
Yeah, I don't know. And I'm having a little bit of a hard time with this hip, and I don't know why.
Well, you said you were tired.
A little bit. Are you good? Should I just go ahead and like finish, or?
I
mean, I don't know.
We're gonna say
Yeah. That's not a fair question to ask you, but
yeah, we could like if you want to go down to the hot tub. I'm like,
yeah.
but this is great. Like, that's a really tender area that you're working on.
Yeah, it seems a little bit more tied up than your right hip.
Yeah.
That feel okay?
Oh, yeah, that's like very tender. That's good.
Yeah. I'll do that a couple more times. Oh gosh, what's going on here? Okay.